someone feels that they're struggling with an addiction, one of the first steps that they can do is to reach out to their primary care provider or someone that they trust in the healthcare field that could give them some guidance about where the best place to go for assistance would be. What makes addiction is four things: is cravings for a substance such as alcohol or drugs, loss of control over the use of that, meaning that when they start to drink, they don't know how much they're going to end up drinking, for example, consequences from their use, family conflicts, missing work, legal problems, and lastly, compulsions, which means using despite your desire not to. Many physicians nowadays have additional training in helping people deal with addiction, especially with drugs such as opioids. That was often the best place to start off with when looking for assistance. In the treatment of addiction, we find that treatment often works best if you combine that with the care of a physician and a mental health professional, such as a counselor or therapist. There are some characteristics that make some people more susceptible to addiction. One would be a family history of addiction and alcohol or substance use disorder, and people that have experienced significant trauma in their childhood. One of the factors that prevents patients from seeking care is fear that they're going to be labeled an addict or that they're going to face legal consequences from that. As physicians, we don't talk to law enforcement at all. Our job is to help people with their medical problems, and addiction is a medical problem. What I would say to patients who are concerned that they may have an addiction but are too afraid to reach out for help, you could do that anonymously as well. There are various support lines that you could call, but I would also recommend talking with your primary care provider and asking, hey, I have some questions about this. What do you think? To learn more, please click on one of the links on the screen or in the description below.